Hello everyone, my name is Dr. Vijay Bhatia and today we are going to talk about cannabis, or in general terms cannabinoids. The main topic is acute intoxication due to use of cannabinoids. In general, the plant cannabis produces chemicals which are psychoactive. So cannabis, also known as marijuana, among other names, is a psychoactive drug. That means it is mind-altering drug from the cannabis plant. It has been used for certain medical, but mostly it has been used for recreational purposes and becomes a drug of abuse. The primary psychoactive component of cannabis is tetrahydrocannabinol, in short THC. There are at least 483 known compounds in the plant, including at least 65 other cannabinoids. But THC is the most active and studied about. Cannabis can be used by smoking, vaporizing, or taken with food, or as an extract. What is the effect of cannabis on the mind? Cannabis has mental and physical effects. It causes a high or stoned feeling and other effects including a general change in perception. So in general, it produces a feeling of high, that you are feeling good, feeling better, but you also feel stoned, as if you don't care. And there are changes in perception, meaning that if you see something or hear something, it is altered in one way or the other. And there is difficulty in thinking. There can be impaired short-term memory, altered sense of time, and impaired body movement, relaxation, and increase in appetite. So if somebody has used cannabis or consumed cannabis, their appetite will increase, they will feel relaxed, and the body just wants to stay in a certain position or limp. And short-term memory is not good, attention is not very good, you have difficult thinking, but in general you feel good about yourself and the surrounding and feel relaxed. At high doses, mental effects include psychosis. That means hallucinations, delusions, and becoming paranoid, or just having paranoid ideas and thoughts, suspicious about the intentions of other people, looking with them that somebody is following them or talking about you or laughing at you, and sometimes even reference. If somebody calls your name in the conversation, you suspect that they are talking about you. And sometimes it happens that they get into more anxiety and more panic state, when panic is the most extreme form of the anxiety, comes suddenly and can be quite distressing. Its physical effects include increased heart rate and sometimes difficulty in breathing. You may feel nausea, and there are some behavioral problems in children whose mothers used cannabis during pregnancy. Short-term side effects may include like dry mouth, red eyes, and feelings of paranoia or anxiety. Long-term adverse effects may include addiction, decreased mental ability in those who started regular use as adolescents, chronic coughing, and susceptibility to respiratory infection. This is possibly because they are smoking cannabis mixing with the tobacco and they are chronic smokers. There is a strong relation between cannabis use and the risk of psychosis, although the case has been debated. Onset of effects is felt within minutes when smoked and about 30 to 60 minutes when cooked and eaten. The effects last for 2 to 6 hours. How do we differentiate, or how do we say when it is acute intoxication as classified in the International Classification of Diseases? So the fact that there is evidence that the person has taken cannabis either from the self-report or somebody telling us, or the patient is smelling of taking cannabis. But on top of that, there may be dysfunctional behavioral or perceptual disturbances, including at least one of the following. So number one is euphoria, feeling good, feeling high, top of the moon, and disinhibited, as if they want to just enjoy and relax and be happy and jolly. There might be symptom of anxiety. In that case, they may develop some agitation, getting more restless. They may become suspicious or paranoid, or they just think that people are talking about him or calling his name. There might be a feeling of temporal slowing. What does it mean? It means a sense that time is passing very slowly, and or the person is experiencing a rapid flow of ideas. Impaired judgment can be there. Impaired attention can be there. So the patient is not able to focus very much. If they start watching a TV or something, they watch for a few minutes and then attention goes somewhere else, and if they get easily distracted as well. There is impaired reaction time. So if they start cycling or driving, or they can feel that they are very slow in putting the brakes on or accelerating or responding to the situation. They may have some kind of illusions. Illusions mean that there is something there, perception is there, but that is distorted. The reality is not shown. So they might feel something is crawling on their skin. They might see something that is unusual, or they might see lights that are flickering a little bit, or they might see if after taking cannabis they are walking down the street in a slightly dark evening and the trees are making some noise, they will feel uncomfortable, as if they are being followed. And if they might even think that somebody is behind them. So there is altered perceptions in terms of auditory, visual, and tactile. Or sometimes they may even have hallucinations because of the high doses they have taken, because of the intoxication it caused. And although hallucinations are there, but their orientation is maintained, meaning they know where they are. They are focused in time, place, and person. They may develop the feeling of depersonalization, as if something is changing in their person, surrounding is not the same, they are not the same, everything feels strange. Derealization, same thing, they feel that surrounding is not the same, or it is very familiar, or it is very strange. So there is some alteration of the reality surrounding them. And number 12, their interference with personal functioning. So their efficiency, whatever they are doing, if they want to dress, it will take a long time. If they want to wash their or cook the food, it is not as efficient as they would have done without taking cannabis and without getting intoxicated with cannabis. So out of these 12 symptoms, at least one must be present for a diagnosis for acute intoxication due to cannabinoids. And obviously the evidence is there that the person has taken some cannabis, either self-report or reports from the others. So once these are the things that would be the patient is telling us, or we look at the patient's behavior, and then we look at the signs which we can observe. The patient eats a lot. There is increased appetite. There will be a dry mouth. The conjunctival injection, that means eyes are flushed and red. There's a lot of blood supply to the white part of the eyeball, which we can see from outside. And there is tachycardia. Their pulse is quite high. The heart is racing. How does cannabis, once it is taken, either smoked or eaten or taken oil or something, what happens to it? What happens is the fresh cannabis, either from the leaves or from its resins, it contains a chemical called tetrahydrocannabinolic acid. So this is an acid. This is then converted into tetrahydrocannabinol. This becomes more of alcohol variety. This is more of acid variety, and this is done by heating. And this is the product which is psychoactive, and once it is consumed or enters into the blood, it will be metabolized by the body into 11-hydroxy tetrahydrocannabinol, and then into 11 or 9 carboxy THC. Both compounds can be glucurinated and mainly excreted into urine. So this is the process which takes place in the liver, which detoxifies nearly a lot of other toxins in the body through glucurination, and then they are excreted safely in the urine. Both compounds, along with THC, are assayed in blood tests, and THC and its major inactive metabolite, cannabinolic acid, can be measured in blood. It can be measured in urine, it can be measured in hair, oral fluids, or even in the sweat, using chromatographic techniques as part of a drug testing program or a forensic investigation of a traffic or other criminal offense. Now, we have found that there are natural cannabinoids called anandamide in the body, in the nervous tissue and other parts of the body, organs or tissues. There are two cannabinoid receptors. Basically, receptors are like, this is a cell wall made up of phospholipids. It has certain gates to allow the substance to come in or go out. And cannabinoid, it is relatively slightly large molecule. It cannot just enter the cell. It needs certain type of gate, which is through which it can enter the cell, and that is called receptor. There are two types of receptors found in the human body and in animals. Now, delta 9 tetrahydrocannabinol and other cannabinoid receptors agonists include therapeutically beneficial effects. So if naturally occurring, like anandamide, attaches here, goes in there and helps within the nervous system, it is believed that they help with the analgesia, that they relieve the pain a little bit, and there is attenuation of the nausea and vomiting which is caused by the cancer chemotherapy. They are also appetite stimulants in wasting syndrome and decreased intestinal motility. However, they have untoward actions because these cannabinoid receptors are everywhere in the body, but mostly in the nervous tissue, peripheral nervous system, and the central nervous system. Untoward side effects accompanying these therapeutic responses include alterations in cognition. That means attention, concentration, judgment, focusing, executive functions like thinking and planning, those things are affected, and memory gets affected, especially the short-term memory. And there might be euphoria, feeling very good, or dysphoria, feeling as if rotten, as if low in mood. And it also causes sedation. Animal models that distinguish cannabinoid receptors activity include drug discrimination paradigms in rodents, pigeons, and primates. A typical static ataxia in dogs is found. So they have problems with the coordination with voluntary muscles, either with the leg muscles or neck muscles. They have problems with that. And tetrad response in rodents. What is that? They have hypothermia, analgesia, hypoactivity, and cataplexy. Hypothermia means the temperature, body temperature gets really low. The body itself has a mechanism to maintain temperature around 37 degrees Celsius. If cannabis is given, too much cannabis is given, or cannabinoid receptors are stimulated, then they lose that ability to maintain that temperature, and it can go into low temperature. Analgesia means the pain is relieved. Hypoactivity means that their muscular activity, they are less active than before. And catalepsy is literally meaning that they become quite limp. The muscles, they just go into some kind of paralysis, and they just fall down, relax, or just lie down as if there is no strength in the muscle, and they just literally fall down if they are standing. Indeed, it is now generally accepted that most CB1 receptors, cannabinoid receptors, are located at central or peripheral nerve terminals, and that their main function is to mediate inhibition of ongoing release of certain excitatory and inhibitory neurotransmitters. So these receptors affect or modulate the release of other neurotransmitters which are well known, especially some of them like glutamate is excitatory, and gamma-aminobenzoic acid, GABA, is the inhibitory neurotransmitter. So the CB1, especially in the central part, they can modulate the activity of these nerve terminals by controlling the neurotransmitter release from them. So they have some impact, and it is also known that they affect the dopamine release, which is the reward center, hence feelings of good and feeling positive. At the same time, there is feeling that they need to continue on that, and as a result, some need for addiction there. These receptors are also expressed by some non-neuronal cells. Examples are the immune cells in the periphery. That's about cannabis. The main thing about cannabis is that it can cause acute intoxication with the symptoms we talked about, and it can affect the brain and the physical body, and there are some good effects and some side effects. And as a doctor in A&E, they need to recognize these symptoms, although the history is clear, but to find the intoxication, if these symptoms are present, they must be monitored, because the effect can last longer, although it is 4 to 6 hours. Another thing about cannabis is because it is a lipid soluble, it stays in the body for a long time, and it can be tested in the urine of patients who have taken cannabis even after a few weeks after. 3 weeks later on, the urine test might be still positive if they have taken the cannabis because of the lipid solubility. If you like this video, press the like button, share with the friends, and subscribe the channel for more on the mental health and symptoms in the mental health, especially to identify the symptoms, and if there are symptoms present, to get and seek the help from the professions who can help you, or the one you love, to get the right support and treatment. I'll see you in my other videos.